Hi guys, this is Michelle and I am back with my 18-month July update. So I have a lot of stuff to say, but this is probably going to be shorter than I want it to be because I'm holding my phone today because something is wrong with my camera. So we'll see how long this ends up being. Okay, let me give you my stats. I had a 6-month supervised diet that started in May of 2016. At the start of that, I was 286.8 pounds. Then I had surgery on January 4th of 2018 at Banner Gateway Medical Center. My surgeon was Dr. Albert Chin. On the day of surgery, I was 251.8 pounds. Today, not today, yesterday, the end of the month, I was 171.4 pounds. So that is actually a 7-pound loss from last month, which I am very excited about. It is a 80.4 pound loss since I had surgery. It is a 115 pound loss since the start of this whole process. And actually, from my all-time highest weight, it is 148 pounds. So I am very pleased with these numbers, especially being 18 months out. Wow, so my 18-month surgiversary was on July 4th. So I'm very pleased, and really, it's all due to intermittent fasting. That is the biggest thing that I changed this month and last month. And also, I had started a little bit in May, but this past month, I really wanted to see what I could do with intermittent fasting, and so I picked things up a little bit, and I did do some intermittent fasting vlogs. I did 3 of those last month for you to really see exactly what I was doing, but mostly I'm still doing I'm trying to go 14 hours with water only. And then I have a cup of coffee with 1 tablespoon of heavy whipping cream so that technically I'm still fat fasting. And I use that to help me get to the 16 hours. So at around 16 hours or whenever I get hungry, then that's when I eat my first real food for the day. So I'm trying to fast from food for 16 hours a day, and then I eat during that 8-hour window. And then in addition to that, twice a week for most of July, oh, my arms are already tired. I did around a 36-hour fast, and I think a few days, maybe 38-hour fast. I might have had a 40-hour fast in there. I don't remember. So I'm very pleased with my results of fasting. The other thing that I did in July, I wanted to get some labs done so I could see, since they're the first time I'm getting the labs done, I don't know how much fasting affected these labs, but I wanted to see, so one lab, C-reactive protein, is a general marker of inflammation in the body. And I do have some issues related to inflammation, so I was curious of what my C-reactive protein is, and fasting is supposed to help decrease that. Well, I had it done. I don't remember what the number is now, but it was low. So that's good that my number is low. I don't know if it's low because of all the fasting that I've been doing since I didn't do it before my fasting. The other thing that I had tested was my insulin level. So these days, doctors monitor your blood glucose, your blood sugar, and also your hemoglobin A1C, which is an indication of really what your blood sugars have been for the previous 3 months. But most of the time, they don't ever do fasting insulin levels, which is something that Dr. Jason Fung talks about a lot in his intermittent fasting videos and his book. He's a nephrologist, and he works almost exclusively with diabetic patients. And he talks about how you know, before you even become diabetic, before you even become pre-diabetic, you become resistant to insulin. And so you have high fasting insulin levels. And so also having high fasting insulin levels also can be an indication of other things going on in your body. It increases your risk for heart disease. I haven't looked at this in a little while, so now I don't remember all the things. I talk about it in more detail in my intermittent fasting videos. So I wanted to see, because before surgery I was pre-diabetic, and now I'm not anymore, but I wanted to see what my fasting insulin level was. Because the other thing is that, you know, high insulin tells your body to store fat. And it's only when your insulin levels are low that your body can burn fat. So if you have high insulin levels, if you're insulin resistant, then it's going to be much harder for you to be burning fat and losing weight. And so that's why I wanted to see what my level was. And my level was low. It actually was much lower than the average American or average person in Arizona. Because I happened to find a study that talked about fasting insulin levels, specifically in women in Arizona. So like the fasting, so yeah, I forgot to look at the ranges. All I know is that, you know, in Arizona, the average level was 8, which is very high, and mine was 4, which was low, and so that was very good. So I'm very happy about those numbers. The other thing that happened this month in July is that I went in for my 1-year physical with my regular doctor. And we had a great appointment. My physical went well. As a matter of fact, it went so well, and he was so pleased with all of my weight loss. And he was looking at my labs from last year. He's like, well, you know, with someone with labs as good as yours, I only do labs every 2 to 3 years. And I was like, no, you can't. Yeah, I was like, okay, I canceled. I did not go to my 18-month follow-up appointment with my bariatric clinic because they don't examine me anyway, and I didn't even see the purpose of going there just to get some labs done. So I told him I was expecting to get labs done with him because I didn't go to my 18-month appointment. So then he was like, okay. And so he went ahead and he ran all of my labs and all of my vitamins because I wanted to make sure, you know, that I'm getting everything that I'm supposed to be getting done as a bariatric patient. But then, of course, I also had my cholesterol tested, my thyroid, my, I forgot what I was going to say. Cholesterol, thyroid, vitamins, vitamin D, I don't remember. Everything was tested. And absolutely everything was fantastic. Like, right in the middle ranges. I didn't even have anything that was on the lower end. My protein, everything was fantastic. As a matter of fact, my total cholesterol had decreased just a little bit, and my LDL had decreased, although they already were very good. Unfortunately, my HDL decreased just a little bit. So previously it had been 78, and this time it was 71. But that's okay, because that's still good. And you know, it doesn't really mean anything. I mean, those are practically the same thing. My triglycerides, which are always very low, were even lower in the 60s. So yeah, every single test was perfect. My vitamin D level was excellent at the high end in the high middle range. So, you know, and they did magnesium and zinc and B12 and all of those things. So I'm very pleased that apparently I'm very healthy and everything looks good. So also during my follow-up appointment, so my doctor, he didn't ask me anything at all about my diet. Sorry, I was trying to see how many minutes I had been talking. He didn't ask me anything at all about my diet or what I was eating or anything like that. But he did ask me about my exercise. And so I told him, you know, I was truthful. I said, I don't go to the gym. You know, I wear a Fitbit every single day, all the time on my wrist here. And I make sure that I'm active and that I'm getting in I have a daily step goal. And I get on my elliptical a couple times a week. And I do arm weights and a little bit of resistance training a few days a week. That's pretty much what I'm doing. And he actually was pretty pleased with that. He started telling me about the results of this one study that he had recently read. And I've seen similar studies where they compared people. They took people who went to the gym and they killed themselves on the treadmill like 45 minutes a day, working out like crazy. And they compared those people to people who did 10 minutes of working out every single day, but they were doing the what is it called? The HIIT training, the high intensity interval training, something like that, where you basically go all out for like 30 seconds, like as hard as you can, and then you, like say if you're on a treadmill, so you would run as hard as you can for like 30 seconds, and then you would walk for maybe a minute, and then run as hard as you can for 30 seconds, and then maybe walk for 2 minutes or something like that. But pretty much they did something like that for only 10 minutes a day, and at the end of some period of time, their fitness results were equal to the people who had killed themselves slaving away in the gym. And I've actually seen other studies on that. I mean, the thing is that, work out smarter, not longer. So anyway, I might start incorporating some high intensity interval training, actually. I really should do that, because I do have an elliptical, but I do have a treadmill, but I don't ever get on it. And it would be easier, to do this on a treadmill, and I can only run for a couple minutes anyway, so that's perfect. What else? I was thinking there was something else I wanted to tell you about my doctor visit, but I think that's it for the moment. Okay, if I remember, I'll bring it up again. But really, it was a fantastic visit. He was just pleased with absolutely everything, and it was really great. Now I'm thinking, oh, I know. The other thing, so we were talking about my weight, and he's pleased with my progress. So right now, I am about 2.5 pounds away from my surgeon's goal weight for me, which was 169. Now, technically, that's kind of high because I am only 5'3", but it puts me at a BMI of 29, which is where my surgeon wanted me to be. And so when I mentioned that to my doctor, he nodded his head and he was like, yes, exactly. BMI of 29, because even though that is still considered overweight, and he quoted the same studies that my surgeon mentioned, the thing is that when they say that being overweight puts you at risk for diabetes or heart disease or high blood pressure or any of these other conditions, cancer, which being overweight does, what they actually mean, or what the studies have actually shown, it is having a BMI of over 30 that puts you at risk for all of these things. So if your BMI is less than 30, that's when you're at less risk. And you're not necessarily at less risk being at a BMI of 25 versus a BMI of 29. It's being less than 30. So as long as I'm less than 30, then that is fantastic. So, right now, that's my goal, is 169. And we'll see what I think. I guess we don't have to see anything. I'm just going to continue doing what I'm doing. I'm going to be very happy, and there's going to be lots of celebration when I reach 169. But then that doesn't mean that I'm going to stop losing. I'm just going to keep doing what I'm doing. And if intermittent fasting helps my weight get down even further, then so be it. But it's not necessarily my goal to try to be, quote unquote normal. I don't care. I don't care to be in the normal weight range, because it doesn't, especially for us, it doesn't mean anything, because I have so much extra skin. And it's like, how many pounds of skin is that? If you really want to be honest, there's no fat in my extra skin, and so technically it doesn't even count. So the thing is that I'm not trying to chase a number or get to a certain number, because the thing is that I don't have any good memories around any of these numbers anyway. The last time I was this weight, I was considered really fat. The last time I was 150 pounds, I was considered fat. The last time I was 140 pounds, I was considered fat. So I don't have any good memories around any of these numbers, so they don't mean anything to me. The same thing with sizes. I remember when I was a 9'10" and crying because I was so fat compared to all the girls who were size 0, because that's when I was a 9'10" in high school, everyone around me, including my mother, was like a size 0. So I thought I was fat. So it's like, there's nothing in my mind that's like, oh, I can't wait till I get to a 10, or oh, I can't wait till I get to an 8, or I can't wait till I get to a 6. I don't care. You know, I really don't care. I can't wait till I reach my surgeon's goal, and then we will see what happens after that. Okay, so let me talk about my calendar. So this is going to be hard because I'm holding my phone, but you see my calendar is all full for July. You know, you'll have to look back at my previous video if you want to know all the things that I was working on for the month of July. So for July, I had tried something different by decreasing my carbs down to 35 net carbs. How did I do with that? Well, not all that fantastic. Only 61% of the time did I have 35 net carbs. But then I went back, because I track everything. I went back because normally I'm at 50 net carbs. Normally I try 50 net carbs. So I went back and I wanted to see, well, how often did I not do 50 net carbs? And so, this month had 31 days in it. I only had 5 days during the entire month where I didn't have at least 50 net carbs, where I didn't have 50 net carbs. So I don't know. I don't think that's too bad. The thing that I did the best on was my water. I only had 4 days during the entire month that I didn't get in my 2 liters of water. The second best thing I did was my sleep, yes. So I was really trying to make sure that I got 7 hours of sleep. And I only had 8 days that I didn't get at least 7 hours of sleep. So what was the thing I did the worst on? My steps. Yeah, I did pretty bad with my steps this month. I only got my steps 58% of the time. So it was still more, I did my steps more often than not, but 58% of the time is terrible, especially since I think last month, I think I got my step goal in about 90% of the time or something. But you see, I increased my step goal, so I don't know, maybe that was it, or I guess I was just getting lazy. I don't know. So now I have goals for August. So this is the thing. I think it's time for me to go back to focusing more on my mood and my energy and my mental health. I used to have meditation on my calendar, but I haven't had it on there for quite a while. And this was a horrible month with meditation. It was bad. I basically have just stopped doing it. I haven't meditated in weeks. And although in my normal life, I feel really good every day, I feel energized, I feel very happy, my mood is up, work is still bad. And maybe one of the reasons it seems so bad is because I'm not doing my meditation like I'm supposed to be doing. So I have switched things around on my calendar for this coming month for August. So goals for August. So 7,000 steps. So I've increased my step goal, even though I did terrible with 6,800 steps last month. I'm going to increase it to 7,000. That's smart. Next, a star for meditation. Okay. Next, dance. Okay, so trying to see, thought I saw something weird. So I've decided, so I took off working out. I'm still going to be working out and getting on my elliptical and doing my weights, but I've decided that every day I'm going to try to dance for at least 10 minutes. So hopefully it's longer, but at least 10 minutes dancing. So I will get a star, and it'll be fun to see how well I do with that by the end of the month. I put my carbs back at 50 net carbs, and there's a reason for that, which I'll talk about in a moment. And then I put sleep back on there because sleep is so important. I'm afraid that maybe I won't focus on it as much if I took it off. So the things I also removed water. I did such a fantastic job with my water last month, and I always do well on my water. Oh, I'm already up to 20 minutes. So I've decided to remove that. Now, the other thing that I really want to talk about very fast, and I forgot to take a picture of it. So for this month of August, I am going to be focusing on vegetables. Although I do love vegetables, and you see I do try to get lots of vegetables in my diet, I don't have a very wide variety of vegetables that I am eating. So in one of my magazines, they were talking about how in the course of the month you should try to see if you could have at least 30 different vegetables. And so I've decided to take that challenge for the month of August, and I'm going to make sure that I have at least 30 of the vegetables on this list. I think the list had about 50. I'll try to put it in here. I don't know if I'm going to be able to do it since I'm doing this on my phone. I probably not. I'll have to show it to you later. But sorry, I had a text message telling me I'm expecting an order from Sephora, and it was telling me it's on its way. Okay, I am going to be doing meal prep videos for the month of August. So there will be 1 or 2 meal prep videos every single week. And so you are going to see how I incorporate all of these vegetables in my diet. And when I come back to you for my August update, we're gonna see, well, you're gonna know how well I did incorporating all of these vegetables into my diet. So that's also one of the reasons why I put my carbs back up 50 net carbs where I normally have it anyway, because supposedly I'm going to be having all of these vegetables, more vegetables with more healthy fiber from the vegetables. We'll see. And I do actually have a meal prep video that I'm going to be releasing in a couple days that I did about a week or 2 ago. I did a whole week of meal prep for a friend, so I am going to be releasing that one first. But yeah, it's going to be the start of a whole month of meal prep videos. So I am going to end this now because it's already much longer than I want it to be. I will be coming back to you guys later on in the month when I reach my goal, because I expect to reach my goal in August. So, and I'm trying to figure out, I don't know what I'm going to do, because it seems like it crept up on me. I did not expect to get here so fast. I mean, in the past 2 months, I've lost like 15 pounds. So I was so far away from my goal, and now I'm so close to my goal, I'm not ready. So I don't know. I'm trying to figure out what I'm gonna do. I'm very excited. So stay tuned for all my meal prep videos, and thank you to all of my new subscribers, and for all of my old subscribers, thank you for watching. Bye.